Hi, this is Josh. I'm a pharmacist with pharmacisttips.com. Here to tell you about the medication methylphenidate. I'm going to touch on some of the uses, side effects seen with this medication, as well as warnings. So specifically, the topics we're going to cover what is methylphenidate. We're going to talk about some of the commonly available commercial products, the side effects, warnings, and some of the things that should be monitored for when this medication is used. Now, with all my videos, this is for informational purposes only, and it's not intended to serve as a substitute for consultation, diagnosis, and/or medical treatment of a qualified physician or healthcare provider. So, what is methylphenidate? It's a CNS stimulant, a central nervous system stimulant. It blocks the reuptake of norepinephrine and dopamine in the synapses in the brain. It stimulates the cerebral cortex and subcortical structures like amphetamines. It stimulates the brain like amphetamines. It has an amphetamine-like effect in the brain. It's used to treat ADHD, attention deficit hyperactivity disorder. It's also used for narcolepsy, people who fall asleep during the day. And off-label, it's used for depression, usually associated with long-term or severe illnesses, and then fatigue, typically due to cancer. That is the typical uses we see for methylphenidate. Some of the commonly available commercial products that we see here in the U.S. include Ritalin, Ritalin LA, Concerta, Jornay PM is a new one that's taken in the evening and then released in the morning, releases into the system in the morning. Metadate CD, Quillavent, Quilichew, or products for children. Many different generic products available out there, and then there's other brand names available as well. Common side effects: insomnia. As this is a stimulant, those stimulant properties can make it difficult to sleep. We want to watch that it's wearing off at the end of the day, so sleep can occur properly. Headache, irritability, unexpected weight loss, dry mouth, nausea, and decrease in appetite. These all can occur. That's to be expected with stimulants, and so if these become issues, certainly something we want to follow up with a healthcare provider about. Other side effects can include changes in heart rate. So we got to be real careful in folks that have any existing cardiovascular or screen to make sure there are no heart problems that can put one at higher risk of heart attack and stroke. Anxiety and other behavior changes can occur. This can kind of offset. We see this, that people taking this, then they have to increase their anxiety meds. Well, if you have an issue with anxiety, medications like methylphenidate just may not be the appropriate option for you. Obviously, something you want to talk about with your healthcare provider, but if you're taking a stimulant like methylphenidate and then you need to take something to control your anxiety, they may need to revisit the appropriate therapy there. Rash can occur. Stomach pain, constipation, back pain has been reported, blurred vision, and other side effects can occur. But the ones we really want to watch out for, make sure that it's not going to put us at higher risk of heart attack or stroke or worsen any existing cardiac conditions. Boxed warning, meaning there's the FDA has required more warning on the printout that you get with the medication, as well as the bottle printouts that come into the pharmacy. But we need to be real careful. There's a high potential for abuse as well as dependence on this medication. We want to make sure it's used under a physician or healthcare provider supervision, and we use it appropriately as prescribed. Because long-term use can lead to tolerance, it can lead to dependence, and if you stop abruptly, it can cause some fairly serious withdrawal symptoms. It can even cause psychotic episodes, so those that maybe have some psychiatric issues, stopping this abruptly could set that off. So we need to be real careful there. Other warnings can include, we talked a lot about the cardiovascular events, so those at higher risk of heart attack and stroke may not be the best medication for them because this can increase heart rate as well as blood pressure. Seizure disorders, this can lower the seizure threshold, so those at higher risk of seizing, that could occur. Priapism, erection lasting more than 4 hours has been reported. Visual changes, make sure You report to your healthcare provider if you have any changes in your vision or difficulty seeing. GI obstruction. This has been reported with the Concerta product. It can cause, so if you get constipation, it can lead to severe issues with a gastrointestinal obstruction. Pretty rare, but something that should be watched for. Circulation problem, those already who have who have poor circulation, and we need to monitor that. And folks with Tourette syndrome or tics, medications like this may not be appropriate for them. Some of the monitoring, like we talked about with the heart issues, we want to make sure that we monitor blood pressure as well as heart rate and weight so we don't get that unexpected weight loss, especially when these products are used in children. We need to be careful that's not interrupting their natural growth. Of course, for other side effects, we want to monitor for that. We want to make sure we're getting good quality sleep. Again, the stimulant properties, we want to be certain that wears off by the end of the day so we can get good quality sleep. Drug holidays, that means taking a break. A lot of times for children, they won't take it on the weekends or on holidays, simply because that can reduce the chance that they become dependent on this. Because this is an issue. Children are put on it in school, and they continue it during school and then into college, and then when they become an adult, it's hard for them to not use this medication. So taking breaks can reduce that dependence, reduce the tolerance. They can become tolerant and requiring higher doses. Certainly something you want to talk to your prescriber about and see if we should take breaks and how that would be appropriate to do. I want to thank you for watching. Subscribe to my channel and go ahead and like this video if you appreciate the information. And you can ask questions in the comments below. Thanks again for watching.